So at this ASH meeting, we are reporting long-term follow-up data for our ongoing trial with Ibrutinib plus Venetoclax. We had previously reported this study in the New England Journal of Medicine a couple of years ago, and more recently updated the work in JAMA Oncology. At the ASH meeting, we are reporting data on 120 frontline patients with CLL with high-risk genetic features who received the combination of Ibrutinib plus Venetoclax. I should emphasize in the previous published work, we had reported data on 80 patients, and now we have 40 additional patients who were enrolled, and now this is a pooled analysis of 120 frontline patients with a median follow-up of around 43 months. So what we see with that serial doublet combination of Ibrutinib plus Venetoclax, more patients continue to acquire MRD negative remission, and at 12 and 24 months of the combination, the results with the additional extended follow-up is pretty similar to what we have already published in JAMA Oncology paper. Now, more importantly, what we are showing here is at the ASH abstract meeting is long-term follow-up of these patients. So what we see is that once the patient stopped therapy at 2-year mark of Ibrutinib plus Venetoclax, only one patient actually has progressed so far among the 77 patients who did that, and most of the patients have remained MRD negative remission. Some patients have recurred their MRD at a low level without any clinical disease progression. Other aspect we studied was that for patients who are still MRD positive at the end of 2 years of therapy, for those patients we allowed an extra additional third year of Ibrutinib plus Venetoclax. And in some of the preliminary results we are reporting, it looks like an additional 50% of the patients are able to convert MRD positive to negative with the third year of therapy for these patients. So overall, I think this data is supporting the other data which has been published in this group for these patients, including CAPTIVATE study, including the CLL GLOW study, which is supporting the concept that combined Ibrutinib plus Venetoclax may be an effective therapy for patients with CLL in the frontline setting. And our data also provides now some longer-term follow-up of these patients and what happens to these patients after they stop the therapy in a large cohort of patients.